Democrats on Capitol Hill sounding positively giddy today, pointing to the CBO report that projects their bill will reduce the federal deficit by $138 billion over 10 years. Here's what Nancy Pelosi had to say about it.
The CBO report that we have, that again, speaks so eloquently. I love numbers. They're so precise.
Yeah, but not so fast, Madam Speaker. Numbers from a report may be neat when they advance your cause, but projections can be way off from the truth. Take Medicare, for example. When Congress first voted on this huge piece of legislation back in the mid-'60s, the House Ways and Means Committee projected that by 1990 it would cost $12 billion. Well, guess what? The actual cost in 1990, look at that, about 10 times as much, $110 billion, and that's not even in the same ballpark. So what do the CBO numbers really tell us? We asked June O'Neill, who is a former director of the CBO, also Nina Ocharenko, who is senior policy analyst at the Heritage Foundation. Nina, good to see you. Miss O'Neill, great to see you as well. Thanks for coming in. Nice. First of all, the CBO is a relatively recent concoction. I mean, it didn't exist back in 1967.
No, well, it came along in 1974.
So it was created as a means of giving us an independent view of the spending. But it does take some things for granted by the people who are giving it the numbers, right?
Well, CBO has to follow certain rules, and it gives that are very literal. It doesn't say what they really think is going to happen.
So let's give a specific. This bill, part of the way in which it creates all this new money is because it says it's going to cut Medicare expenses in half over a 10-year period. That would mean $500 billion cut out of Medicare. It's nothing like that has ever been done, but the CBO accepts that it will be done in coming up with these figures.
Yes, if that is what's written there, it's assumed that it will happen. And of course, we have a really dramatic illustration of how unlikely such a thing is to happen with the doc fix. In fact, I've been looking all around. I don't see anywhere in this legislation where the doc fix is mentioned.
Okay, and just to explain for folks who don't know, doctors, as we explained in the last segment, are not getting paid as much from Medicare as they think they should, and in fact, their payments are going to be decreased
by 21%.
By 21%, unless there's a doctor fix. This bill assumes that there will not be a fix, and that means $200 billion in savings.
Well, no, that can't be savings since current law calls for the 21%. This bill assumes that there will be another piece of legislation that will make the doctors whole, and then they chip away from that. It would obviously be ridiculous to start with the 21% reduction and then...
Okay, and the other assumption then is on the other side of the ledger, the taxes, the tax receipts. They are assuming that when they raise all these taxes, they will get a certain amount of income, but very often when you raise tax rates, particularly wealthy people can afford accountants that figure out ways to avoid paying them, so they don't get the money that they think they're going to get.
Actually, it's not CBO that does the tax estimates. That's the Joint Committee on Taxation, and they are more of a black box than CBO, because they don't ever explain how they get their numbers. But these are like a pastiche of all sorts of taxes, the tax on tanning, tax on medical devices. You know, at the same time that we're supposed to be improving access to preventive care, mammograms, colonoscopies, and all those other things, there's a tax now on those devices. So they're going to be more expensive. They're not going to be swallowed by the device
Let's
makers.
Bring in Nina. Nina, what do you think of the CBO numbers, and what do they prove, if anything?
Well, I think that no one should be surprised that the Democratic leadership manipulated the proposal itself to get the results that they wanted. And I think it's already been highlighted very well that the results mislead the American people about the true cost of the bill and really what it will accomplish. And I think the deficits, just a couple of points on that. Exactly, $371 billion to fix the doctor payments that isn't included in the bill. And now we're supposed to believe that they're going to have $500 billion in Medicare cuts over the next 10 years, amount to something. And finally, on the tax hikes, you know, it's interesting. They pushed a lot of the tax increases to the out years so that they raise the revenue to make the deficits look like they're going down. And, you know, I think it's also interesting that it's been pushed off so they're not in the political window of this election cycle as well. So the American people...
I've got a novel idea. Why not just pass the tax savings or the savings from Medicare Right now, try to get the savings first. That is, get the $500 billion in the bank before you go the distance and provide all these extra services.
That's right. Let's bank the dollars first. If they believe that there are these savings, let's prove it to the American people, see how much money we raise, and then from there figure out what can we do with the amount of money to help deal with the coverage issues in our country.
Nina, we didn't even, June, we didn't even talk about the fact that they're using 10 years worth of tax income in order to pay for 6 years worth of expenses.
Yeah, and nobody is really going to be enjoying those subsidies and other kinds of benefits until 2014. That's 2 years after the next presidential. And then they don't really kick in full swing until 2015. But I just wanted to make one point. Everyone is sort of cheering as though the deficit reduction wasn't present. The Senate legislation that everybody was throwing their arms up about and aghast about, that had almost the same amount, the same number for deficit reduction. There's very little difference between this bill and the last Senate bill. It's mostly zeros. Looking at change from Senate bill, 0, 0, 0.
Nina, does anybody inside the Beltway really believe in these numbers?
I don't think that they honestly can believe that this is the way it's going to go. And I think you pointed out earlier, none of these government health care programs actually spend what they say they're going to spend. They always go up over time, and that's what the American people are going to have to face in the years ahead.
Nina Ocharenko from Heritage Foundation and June O'Neill, former director of CBO. Great to see you both.